I think this is a very timely and important question. So CHARTED was a phase 3 clinical trial that really tried to answer the question, what is the role of early chemotherapy in addition to ADT or androgen deprivation therapy in men who have metastatic prostate cancer. So that study did show that additional docetaxel really improve overall survival in men, especially with those with high volume disease. Now, the updated results that was presented here at GU ASCO really asked the question, is there additional benefit in learning the genomic classifier? So what they did was they took 160 patients out of these men and they used a platform called PAM50, which is a platform that initially was used for breast cancer to stratify patients accordingly to luminal A, luminal B, or HER2 or basal subtypes. Now, they also used PAM50 for an earlier study to look at the effects or the benefit from ADT. So in particular, the results of the ECOG 3805 trial using the PAM50 genomic classifier shows that 52% of the men had luminal B and 48% had basal subtype. Very few had luminal A, only about 2%. But what's most striking is that the benefit of docetaxel seems to be driven also by the men who had luminal B. So there was improvement in overall survival, as well as time to castrate resistance development. So does this mean that we all should be checking the genomic classifier in such patients? I would say the numbers are still kind of small. So I think they are very provocative, results, but probably not yet prime time to really drive practice or change practice at this time, because we also don't want to deny patients chemotherapy if the clinical indication, i.e. high volume disease, exists.